This is NDTV. And you're watching NDTV 24/7.
Welcome, you're watching Living with COVID. I'm Rishika Barwa. Well, we're dealing with the new normal as we get on with our daily lives. What are the do's and don'ts? More importantly, what happens to critical disease management in a pandemic? We're joined by a panel of expert doctors from around the country. Dr. Kumar Prafull Chandra. He is the director at the Chandra's Diabetes and Heart Clinic from Gomti Nagar in Lucknow. We also have Dr. Aziz Khan. He's an interventional cardiologist at the Crescent Heart Hospital in Nagpur. Appreciate you, doctors, for sparing the time of day. You know, it's been observed that many patients are not visiting hospitals and clinics due to the fear of the coronavirus infection, and also because of the fear of being detected with COVID-19 and having to undergo, the whole idea of institutional quarantine. What's your opinion, Dr. Chandra? How can we combat these fears?
See, this is a real fear that we do have in our society at this point of time. We need to understand that because of this fear, many patients who are having mild symptoms or are having mild fever, they are not coming to healthcare professionals, because of which they stay back at home and they are spreading the disease within the community. Now, fear of institutional quarantine has its own limitations, which has to be overcome so that early diagnosis is done, proper counseling of the patient is done, so that they are educated and they do not transmit the disease within the society.
Right.
For that, some changes in guideline has to be done. Facility of home quarantine has to be accepted since the number of cases are going to increase. So a simple guideline of treatment on outpatient basis has to be adopted so that patients come out early in their disease, get proper treatment, get proper counseling, and do home quarantine as per the standards so that transmission of disease within the society is stopped, and so the exponential way the disease is increasing can be retarded.
All right. So I think inspiring confidence among patients is key, as per what you're saying. But Dr. Khan, what are the steps that doctors are taking to make their clinics and OPD safe for patient visits in a pandemic? Could you elaborate on some of the procedures or steps that are being taken, so that patients are not fearful of other critical disease management?
Yeah, we have been doing what I will tell you. The first and foremost things are that patients should be made aware that our clinic is fully hygienically maintained. We are maintaining the social distancing and we are maintaining the proper appointment system. So what you have to do is, we take patient by appointments. But being a cardiology hospital, we also get patients without appointments. So what we do is, first, as soon as patient comes, we have given them forms so that they clear that they are not having any fever, there is no travel history, and they are not in contact with any COVID positive patients. After that, their temperature is taken, and then if needed, X-ray is taken. And after history in the OPD by RMO, the patient is sent to our OPD, where we maintain the social distancing. Even the blood pressure is taken in a proper way. ECG is taken after sanitation of each and every patient. And then these patients we also see that our our counter people are not infected. So we maintain safe distance. They wear face shield, they talk with some distance, and then we try that they don't pay also in cash, mostly by the other way. Okay. Then when the patient comes to clinic, we ensure that they are not, we see them mostly by history, and then if required, we avoid elective procedures like echocardiography, elective angiographies.
Right.
We only do emergency echocardiogram, like that.
Okay.
So ensure that everything is safe, hygienic and well maintained.
Even before entry to the clinic, we do have a specialized screening area where Patients are screened by thermal scanner for their temperature or has not come into contact of COVID-19. We sanitize the patients and then bring them to the reception area. The regular entrance of the clinic is closed to avoid the rush of the patient directly into the waiting hall. We have restricted the entry of attendants so that minimum number of people are sitting in the waiting hall. In the waiting hall, we have replaced the regular chairs with wooden single armless chairs so that there is minimal contact in between the patients, furniture and amongst the patients. We are maintaining a distance of 1 to 2 meters from the doctor to the patient so that transmission does not occur. Apart from that, regular sanitization of the clinic is done once in a day by 5% hypochlorite solution.
All right, very interesting that you've elaborated on procedures for heart patients, especially. I think a lot of those predisposed with cardiac conditions have several questions. Dr. Chandra, is the risk of developing severe COVID-19 symptoms similar for all patients with a heart condition, or are there differences? If you're already predisposed to a cardiac condition, are you at a higher risk of getting the disease, or once you contract the infection, are there chances of further complications, and how does it differ among heart patients?
So this is a beautiful question. It has got two parts. Let me explain you what is the risk of getting infection and what is the risk of getting severe infection. So risk of getting infection in heart patient or diabetes patient is similar to that of any other person who is not having disease. However, if a patient with pre-existing illness develop COVID-19, chances of getting severe infection is higher in them. And most importantly, the coexisting illness because of which their immunity is compromised, their respiratory function is compromised, and their ability to fight the acute condition associated with COVID-19 is decreased. So, chances are same. However, once infected, any patient with heart disease or diabetes will have severe infection. Now, within the heart disease, those patients who are poorly controlled, those patients in whom heart failure symptoms are present, those patients in whom respiratory compromise is there because of respiratory involvement in the heart, in them, the reserve capacity to fight the infection, the reserve capacity to perform the physiological requirement of the body during the infection is minimized. And in such cases, chances of getting severe infection requiring hospitalization and ICU management is high.
All right, very interesting, in order to understand how the disease actually affects heart patients. But Dr. Khan, if I can come back to you on this point, now that we know that those with a predisposed heart condition or other comorbidities are at a greater risk of the infection, what are the steps that such people can take, from preventing this from happening, from preventing them from contracting the infection?
Actually, we exactly don't know why many patients with COVID-19 are getting more affected in patients with heart disease. But it is true. That many patients, if they get infection, they either die or they have increased complications. Now, the most important thing is that you cannot be assured that anybody will have 100% zero risk. The most important thing will be these patients. Self-quarantine is the most important. We should encourage these patients not to go out of the home unless it is required. Even if they go out, they should have minimum contact with the people, get their work done and come back home. And while doing that, they should wear masks, they should carry tissue paper, they should have sanitizer, and they should wash hands regularly. You have to assess your risk as per your condition, and you should avoid going to places where the large gatherings are there, like marriages or funerals. All these things should be avoided. And they should take their medicines regularly, they should get their checked regularly, and in case they get any symptoms, they should contact their doctor as early as possible.
Dr. Khan, another question, that many of our viewers also want to know: are there any heart medications like ARBs that need to be avoided during COVID-19?
Yeah, actually, these ARBs or ACE inhibitors, they are the main drug in the cardiology in patients with heart failure, in patients with heart attack, in patients with coronary disease and high blood pressure. Most of the patients are taking these medicines. When the COVID outbreak started, there was concern that these patients who are taking these medicines have increased mortality and morbidity. The reason they put that, the COVID-19, this gets access to the host through ARB2 receptors. And therefore there was anxiety and fear among the physicians and cardiologists, and they started stopping the drug in these patients. But now, after the observation studies by many professional bodies, now it has been shown that these drugs does not cause any harm. In fact, these drugs are beneficial. So ESC, ACC, Canadian associations or Australian associations, all the cardio societies have endorsed use of ACE or ARBs in patients with COVID. In fact, I continue my patients on these drugs once they get COVID.
All right. And at what time or what condition should a patient with diabetes or heart diseases consider going to a hospital or a clinic for a checkup or even COVID-19 testing, Dr. Chandra?
See, the way COVID-19 is being transmitted, we prefer that those patients who are stable, who do not have any deterioration in the symptoms, should stay back at home, taking the regular medicines as prescribed, and they should consult their physician by telephone or by video conferencing. However, there are certain conditions in which patient need to visit hospital. For cardiac patients, if there is sudden deterioration of the symptoms, breathlessness has increased, swelling in the legs have increased, or patient has developed chest pain. So these are the acute conditions which cannot be avoided, which needs physical visit to the hospital. Similarly, in patients of diabetes, if blood sugar is well controlled, blood pressure is well controlled, and patient is feeling healthy, they can stay back at home. But if there is sudden change in blood sugar and blood pressure levels, patient develops symptoms of ketoacidosis, patient develops fever, or any acute condition where diabetes becomes a parameter to know the exact seriousness of disease. And in those conditions, hospitalized care is needed. Many times we have seen that a patient of diabetes, if develops any type of infection, gets his blood sugar level sky high and at times develop ketoacidosis, which is potentially life-threatening.
All right, I think that's very crucial advice that will be noted, of course, by diabetes patients or patients who have, any other comorbidities, for instance. Dr. Khan and Dr. Chandra will continue to be live with us. We're going to slip into a very short break, but we have lots more questions and answers coming up on the other side. Stay tuned. Welcome back. Well, now that we're all traveling to work, people going back to offices, it's becoming more and more common. What are the kind of steps that can be taken to make travel safer? Dr. Khan, if I can, come to you. For people who still have to use public transport, or sometimes people who can't be using their own vehicles for whatever reason, what would you recommend to them?
Yeah. Now the lockdown is over, so you have to go to your work. I will suggest the safest way is your own vehicle, whether car or two-wheeler. In car also, when you take up the car, you have to take some steps, because sometimes the fomites might be there on the handle or on the steering. So before you ride the car, you sanitize the car, at least handle and steering. Try to avoid driver, because you don't know from where the driver has come, what infection he is carrying. If possible, drive your own vehicle. If you are on two-wheeler, you can safely drive with face mask, with goggle and helmets. And if at all you want to use public transport, please try to avoid the peak hours. And number 2, don't be in very hurry to catch the train or bus. Don't rush in a train or bus which is heavily loaded with people. Try to keep distance with other people. Always carry with you at least cotton mask, sanitizer, and if at all you want to sneeze, you sneeze with the both flexed elbows and immediately clean your hand with sanitizer. Wherever you work, try to see that the atmosphere there is fully hygienic. I think these are the steps one should take while taking the private or public transport.
All right. The other big aspect of the pandemic, the lockdown, of course, has been the mental aspect of it. How does one manage mental stress? Several people who are not used to staying indoors for long periods of time are now confined, to their homes. Dr. Chandra, what advice would you give people in combating the mental aspect of this entire pandemic?
This is really a big problem that patients or public in general are having. Now we are having calls from the patients regarding depressed mood, not willing to do any work, and we are calling it corona associated stress, and that's the reality. And that is mostly because we are confined to our rooms or to our home. Now in such conditions we have to adapt ourselves to the requirement that this COVID-19 has brought to us. Let us understand this COVID-19 is going to stay unless we develop immunity against them either by vaccine or by herd immunity. And in any way it is going to take a lot of time. So we need to learn how to live with COVID-19. And for doing that, we need to structure our routine in such a way that we are following as if we were going to our workplaces. Getting up early as we were doing during our working hours, doing a little bit of exercise, yoga in the morning. Then when you have to come to the work, even working from home, try to develop a room where is a work office sort of thing for you, where you start working like as if you are in an office. So you have to develop your surrounding the way you were doing when it was not restrictions around.
Right.
So with all these changes, you will see that the way you were living earlier, your life has started living now. And in this way, the stress associated would decrease. One of the most important aspect is doing regular exercise. Yoga reduces the stress level by release of different internal hormones and endorphins. So they are very important and they should be taken. A routine followed, a fixed time for sleeping, a fixed time of getting up. Do not do partying late night. Do not think that you are at leave. Just think that you are living a normal life and you are in an office and you are working according to that, and a bit of exercise. These things are important to keep you lively and not have mental problems all around.
All right. I think very important to address the mental impact of not just the pandemic, but also, the lockdown, and it has, impacted people mentally in several different ways. I want to also ask you, many people have pets at home. Can one get the COVID-19 infection from a pet? What are the kind of precautions that one should take? Because, you have to walk your pets, especially if you have a dog. Dogs are generally walked maybe twice or even thrice in the day. So what are the kind of precautions that you can take, and what's the threat perception when it comes to pet animals, Dr. Chandra?
This is really a good question once again, because there were some initial reports coming in that few animals in some zoo were found to be infected by COVID-19. We all know that COVID-19 or Corona SARS-2 is a zoonotic virus which has basically come from animals and then to the human. So virus has jumped from animals to human. Now the transmission is occurring amongst human. Chances of transmission of COVID-19 through pets are not proven as of now, so the chances are not there. However, standard hygiene practice should always be maintained, because it is not only if the animal gets infected then only it will transmit, but their body surfaces may also get some virus from environment. And once you are playing with these pets, there are chances that those virus which has not infected them but they are present on their surface may infect us. So proper hygiene, washing of the pets should be done as we are doing routinely with ourselves, and that is the way you can prevent transmission of COVID through pets.
All right, last question to you, Dr. Khan. Any special advice that you'd like to give, people who are suffering from diabetes or heart conditions in times of a pandemic?
The most important is maintaining physical and mental health. I think Dr. Chandra as well elaborated about the mental health. These two things are very important. When the person is at home, he will take unhygienic food or heavy meals. So you have to take balanced food in time. Number two, you should ensure that you do regular exercise. The recommendation is 150 minutes per week moderate or 75 minutes per week severe exercise. And then you should maintain your blood pressure and diabetes in a proper way. I advise my patients to have glucometer and BP apparatus at home. They should measure their blood pressure, diabetes at home, and talk to me on phone. And then they should ensure that they have adequate supply of medicine with them. They should see that they maintain their health very well. In case they get any problem, they should consult doctor. Being happy, healthy is very important. And then you have to maintain that you have to live with coronavirus now. So try to live with it in a normal way. Please don't get panic.
All right. I think the bottom line really is that we all have to learn to live with it. So we may as well not panic and learn to adapt to a new normal. Dr. Khan and Dr. Chandra, thank you so much for joining us on the broadcast.